What is counter-conditioning, and how can it be effectively applied to modify an animal's fearful response to a specific stimulus? Answer: counter-conditioning involves pairing a negative stimulus with a positive outcome to change the animal's emotional response. For example, if a dog is fearful of vacuum cleaners, pairing the presence of the vacuum with high-value treats like small pieces of chicken can help associate the vacuum with positive outcomes. Effective application involves stimulus control. Begin with the stimulus, vacuum, at a distance where the dog shows no fear. Positive reinforcement. Deliver treats immediately upon presenting the stimulus. Gradual exposure. Gradually move the vacuum closer over multiple sessions while continuing to pair with treats. Avoid flooding. Ensure the stimulus does not overwhelm the animal as it could backfire. Ethical considerations include recognizing signs of stress, e.g., lip licking, yawning, and ensuring that the process respects the animal's tolerance levels. Explain how selective serotonin reuptake inhibitors, SRIs, work and identify a behavioral condition where their use is commonly indicated. Selective serotonin reuptake inhibitors, SRS, work by inhibiting the reuptake of serotonin, a neurotransmitter, in the brain, thereby increasing its availability in the synaptic cleft. This helps regulate mood and anxiety-related behaviors. SSR is commonly prescribed for conditions like separation anxiety, compulsive behaviors such as excessive licking or tail chasing, and generalized anxiety in animals. By increasing serotonin levels, SSR is helped modulate emotional responses, reduce anxiety, and improve behavioral regulation. For example, fluoxetine, a common SSRI, is often used to treat dogs with separation anxiety by alleviating stress during their owner's absence. However, SSRI treatment is most effective when combined with behavior modification techniques like desensitization and counter-conditioning. It's important for veterinarians to monitor side effects, such as lethargy or changes in appetite, and adjust dosages accordingly. The AVSAB guidelines advocate for a combined approach of medication and behavioral therapy to address long-term behavioral disorders, ensuring the animal's well-being is maintained throughout treatment. Describe 3 effective strategies for improving client adherence to a behavior modification plan. Answer: active listening. Understanding a client's concerns, e.g., time constraints or skepticism, is essential. By actively listening and validating their feelings, the consultant builds trust and opens communication channels, ensuring the client feels heard and involved in the process. Clear communication. Educating clients about the principles of behavior modification using simple language and visual aids helps them grasp complex concepts like reinforcement and desensitization. Analogies or real-world examples can make the concepts more accessible. Follow-up structure. Regular follow-ups, e.g., weekly check-ins, ensure that the plan remains on track. Offering solutions for minor setbacks and celebrating small victories boosts client motivation and adherence. AVSAB guidelines stress the importance of a transparent, client-centered approach that emphasizes clear communication and shared decision-making. The consultant should also address any emotional responses or resistance from clients, ensuring they understand that adherence to the plan is key to achieving positive results for the animal. Dr. Patel is working with a client whose large dog shows aggressive behavior when approached by strangers. One day, during a session, the dog lunges toward a visitor in the home. What immediate steps should Dr. Patel take to ensure safety and address the behavior? Answer: immediate response. Dr. Patel should first ensure that the dog is safely restrained using a leash or crate to prevent further aggression. A muzzle may also be necessary if the dog has a history of biting. Client safety protocols. Instruct all people in the room to remain calm, avoid eye contact, and make no sudden movements, as this may escalate the aggression. Assess triggers. Dr. Patel must identify potential triggers, e.g., a specific visitor, approach speed, or body language. This allows for tailored future interventions. Emergency plan. Recommend the use of a muzzle for future sessions if aggression persists, while implementing desensitization techniques gradually. Client counseling. Educate the client on warning signs of aggression, e.g., growling, stiff posture, and teach strategies for safer interactions with strangers, such as controlled introductions and using body language that appears non-threatening. The AVSAB stresses safe, humane practices for dealing with aggression. Preventing further escalation through restraint and providing client education ensures both safety and long-term behavioral change. How does systematic desensitization differ from flooding and treating noise phobias? Which is more ethically appropriate? Answer: systematic desensitization. This technique involves gradually exposing the animal to the fearful stimulus, e.g., thunder sounds at a low intensity, while pairing it with positive reinforcement like treats. Over time, The animal learns to associate the stimulus with positive outcomes, reducing fear. Flooding. Flooding exposes the animal to the full intensity of the fear-inducing stimulus until the animal becomes exhausted or habituated. This technique is controversial as it can cause severe distress and is not always effective. Ethically appropriate, systematic desensitization is considered more humane as it minimizes stress and respects the animal's emotional needs. Flooding can lead to trauma and emotional harm, which is why it is generally discouraged by organizations like the AVSAB. AVSAB guidelines favor systematic desensitization and emphasize a gradual approach that supports the animal's welfare. Overwhelming the animal with flooding techniques can cause long-term negative effects and is discouraged. Explain how serotonin impacts aggression in animals. What are the underlying mechanisms and how might an imbalance manifest behaviorally? Answer. Serotonin is a neurotransmitter that regulates mood, impulsivity, and aggression. It exerts inhibitory effects on areas of the brain like the amygdala, which is responsible for emotional responses such as fear and aggression. When serotonin levels are low, this inhibition is diminished, leading to heightened aggression. For example, in animals, low serotonin can lead to impulsive aggressive behaviors and poor impulse control, seen in species like dogs or primates. An imbalance in serotonin can manifest as erratic behaviors like sudden outbursts of aggression, territoriality, or anxiety. The mechanisms underlying this involve serotonin's ability to modulate the limbic system and prefrontal cortex, where emotional regulation and decision-making occur. Environmental factors like chronic stress, diet, or genetics can alter serotonin levels, contributing to aggressive behavior. A relevant guideline. Veterinary behaviorists often use serotonin reuptake inhibitors (SRIs) as part of the treatment for aggression when serotonin imbalances are suspected. AVSAB supports the integration of pharmacological treatment with behavioral therapy for managing aggression. Compare and contrast the behavioral effects of acute and chronic stress in animals, emphasizing the roles of cortisol and adrenaline. Answer. Acute stress results in an immediate fight or flight response. The body releases adrenaline, preparing the animal for quick action. This leads to increased heart rate, heightened awareness, and a surge in energy. For instance, a dog may react aggressively when startled by a loud noise driven by adrenaline. This short-term response is adaptive for survival in immediate threats. Chronic stress, on the other hand, involves prolonged activation of the hypothalamic pituitary adrenal HEA axis, resulting in the sustained release of cortisol. Over time, elevated cortisol can impair cognitive function, reduce immune response, and lead to anxiety, aggression, or learned helplessness. For example, a cat continuously exposed to stressful conditions may develop behavioral problems like hiding, excessive grooming, or aggression toward its owner. A relevant guideline. AVSAB suggests using stress reduction techniques such as environmental enrichment, behavior modification, and, in severe cases, medications to address chronic stress in animals. Compare and contrast fixed action patterns, FAPs, and learned behaviors. Provide examples for each and explain how ethologists determine whether a behavior is innate or learned. Answer. Fixed action patterns, FAPs, are innate, stereotypical behaviors triggered by specific stimuli. Once initiated, FAPs are executed without modification and continue until completion, regardless of external changes. For example, geese rolling an egg back into their nest after it rolls out is a typical FAP. Ethologists identify FAPs by isolating behavior from environmental factors, showing that it occurs even in animals raised in isolation. Learned behaviors, on the other hand, arise from experience and environmental interactions. These behaviors can change over time depending on the individual's learning. For example, a dog learning to sit on command via positive reinforcement is a learned behavior. Determining innate versus learned. Ethologists use experiments where animals are raised in controlled environments, e.g., isolation, to observe if a behavior still occurs. If it does, it is likely innate. If it requires experience, it is learned. Tinbergen's 4 questions causation, development, function, and evolution help in this analysis, allowing ethologists to better understand the nature of the behavior. Explain the difference between classical conditioning and operant conditioning. Highlight a scenario where both might interact in an animal behavior modification plan. Answer. Classical conditioning involves associating a neutral stimulus with an unconditioned stimulus to elicit a conditioned response. For instance, a dog learns to salivate, conditioned response at the sound of a bell, neutral stimulus after it has been repeatedly paired with food, unconditioned stimulus. Operant conditioning is based on consequences. Behaviors are reinforced or punished to increase or decrease their likelihood. For example, a dog sitting to receive a treat uses positive reinforcement. In a behavior modification plan, Both conditioning methods may be used. Imagine a dog afraid of thunderstorms. Classical conditioning: gradually pair the sound of a thunderstorm with positive stimuli like treats, reducing fear responses. Operant conditioning: reward the dog for remaining calm during a storm to reinforce desired behavior. The combination of classical conditioning associating fear with something positive and operant conditioning reinforcing calm behavior can address both emotional responses and observable actions. Discuss the role of optimal foraging theory in animal behavior and provide an example of how this theory applies to resource acquisition strategies in companion animals. Answer: optimal foraging theory suggests that animals will forage in a way that maximizes their energy intake while minimizing the time and energy spent on acquiring food. This behavior is driven by natural selection, where animals that efficiently forage have a better chance of survival. For instance, in the wild, the bird may prioritize eating easy-to-catch insects over larger, more difficult-to-hunt prey, especially in a food-abundant environment. This minimizes effort and maximizes energy intake. In companion animals, this principle can be applied to their food acquisition behavior. For example, a dog might prefer a high-value treat over kibble, showing a preference for greater caloric rewards when both are available. This behavior mimics optimal foraging, where the dog selects food that provides the most reward for the least effort. Relevant guideline: understanding OFT can be used in behavioral enrichment programs. For example, hiding food or using puzzle feeders encourages animals to work for their food, providing both physical and mental stimulation similar to their natural foraging habits. Dr. Kim is consulting on a case involving a group of parrots in a rehabilitation center. The younger parrots are observed mimicking the feeding techniques of older ones, including cracking nuts using a specific tool. Some younger birds fail to replicate the technique successfully. What learning process is occurring in this scenario? What steps should Dr. Kim take to enhance the younger parrot's learning outcomes? Answer: the learning process occurring is observational learning, specifically imitation and emulation. Imitation involves replicating the exact behavior observed, while emulation involves achieving the same goal but using a different method. In this case, the younger parrots are imitating the tool use of older parrots to crack nuts, but some may struggle with the technique. To enhance learning outcomes: facilitate observations, allow younger parrots more opportunities to observe older, skilled birds. Repetition increases learning. Scaffold learning: provide partial access to the goal, e.g., pre-cracked nuts to reduce difficulty and gradually build skill. Reinforcement: reward the younger parrots when they successfully replicate the behavior to reinforce learning. Relevant guideline: social learning is essential in many species, and Dr. Kim should ensure that the parrots can learn through observation, especially when replicating complex behaviors. This method can speed up the rehabilitation process. Describe the differences between continuous and intermittent reinforcement schedules. Why is intermittent reinforcement more effective in maintaining behaviors over time? Answer: continuous reinforcement is when every occurrence of the desired behavior is reinforced. This method is ideal for teaching new behaviors. For example, a dog receives a treat each time it sits on command. Intermittent reinforcement occurs when only some instances of the behavior are reinforced. This method is more effective in maintaining behavior over time, as it creates unpredictability, making the behavior more resistant to extinction. For example, a dog may receive a treat after sitting on some occasions, but not every time. Intermittent reinforcement is effective because the unpredictability of rewards increases the motivation to continue the behavior. It is akin to gambling behavior, where the chance of winning reinforcement increases persistence. Relevant guideline: trainers often use intermittent reinforcement to maintain behaviors after they've been learned, transitioning from continuous reinforcement to ensure long-term behavioral persistence. Explain extinction and spontaneous recovery in classical conditioning. How can these concepts be applied to mitigate a dog's fear of thunderstorms? Answer: extinction in classical conditioning occurs when a condition response, CR, diminishes because the conditioned stimulus, CS, is presented without the unconditioned stimuluses. For example, if a dog's fear of thunderstorms, CR, increases when the sound of thunder, CS, is paired repeatedly with a calming experience instead of a frightening one. Spontaneous recovery is when a previously extinguished CR suddenly reappears after a period of no exposure to the CS. For example, the dog might again show fear at the sound of thunder after several calm experiences. To mitigate fear of thunderstorms, gradually expose the dog to the sound of thunder at a low volume while providing positive stimuli, e.g., treats or play, helping to extinguish the fear. Monitor for spontaneous recovery and resume exposure if the fear reappears, reinforcing calm behavior consistently. With a relevant guideline, desensitization and counter-conditioning are effective strategies for treating phobias, including thunderstorm fear, by altering emotional responses to previously fear-inducing stimuli. Analyze the relationship between territoriality and reproductive success in animals. Provide examples of how this manifests in domestic or companion animals. Answer: territoriality refers to the defense of a specific area that contains resources necessary for survival and reproduction. In many species, territoriality ensures access to food, shelter, and mates, which directly influences reproductive success. For example, male lions establish territories and defend them to secure mating opportunities with females. In companion animals, territoriality can also impact reproductive success. Male dogs may mark their territory with urine to signal their presence and availability to mate, especially during the breeding season. In multi-pet households, territorial behaviors may lead to conflicts or dominance hierarchies. Relevant guideline: understanding territorial behaviors helps in managing multi-animal households by providing sufficient space, establishing safe zones, and preventing conflict over resources. Discuss the differences between imitation and emulation. How does each contribute to the transmission of behaviors in animal groups? Answer: imitation involves copying the exact actions of another individual. It is commonly observed in species that rely on complex social behaviors, such as primates or birds using tools. Emulation, in contrast, involves achieving the same goal as another individual but through different methods. Both processes contribute to the transmission of behaviors within animal groups. Imitation is important when precise behavior replication is necessary, while emulation can lead to innovation as animals adapt learned behaviors to new contexts. For example, chimpanzees can imitate using sticks to extract termites, whereas younger chimpanzees might emulate the goal, termite extraction, without copying the exact method. Relevant guideline: observational learning allows animals to acquire behaviors without trial and error experience, improving survival chances in complex environments. Compare and contrast habituation and sensitization. Provide examples from animal behavior that illustrate these concepts. Answer: habituation is a decrease in response to a repeated stimulus over time. It occurs when an animal learns that a stimulus is harmless and no longer requires a response. For example, a dog might initially bark at a car horn but stop reacting to it after repeated exposure. Sensitization is an increase in response to a repeated stimulus, often due to the stimulus being perceived as threatening or intense. The dog might become more agitated with repeated loud noises, such as fireworks, as its sensitivity to the stimulus increases. Relevant guideline: these concepts are fundamental in understanding how animals adapt to their environments, and they can guide training and desensitization techniques. Explain how evolutionary theory relates to animal behavior. How does natural selection influence behavioral traits? Answer: evolutionary theory posits that behaviors are shaped by natural selection to enhance survival and reproductive success. Behaviors that increase an animal's chances of survival are more likely to be passed on to offspring. For example, mating displays in birds, such as peacock feathers, increase reproductive success by attracting mates, even though they may increase predation risk. In companion animals, natural selection also influences behavior. For example, dogs have developed traits such as loyalty and cooperation, which increase their value as companions and working animals. Relevant guideline: understanding evolutionary influences on behavior can help in training and managing animals by recognizing instinctual behaviors shaped over generations. Outline 3 immediate interventions for managing a dog experiencing acute separation anxiety. Answer: environmental modifications. Provide the dog with stimulating toys like puzzle feeders or treat dispensing devices, which distract the animal from the absence of their owner. Temporary management. Use calming aids such as pheromone diffusers, e.g. Adaptal, or anxiety wraps like thunder shirts to create a calming environment. Owner departure desensitization. Gradually increase the duration of the owner's absence through short, frequent departures, helping the dog learn to tolerate being alone without becoming overly stressed. The AVSAB recommends these approaches as they focus on the animal's emotional needs and avoid aversive methods that can increase anxiety. Behavioral modification and medication may also be necessary for long-term management. Describe the process of shaping and give an example of its application in teaching a dog a complex task, such as opening a door. Answer: shaping is a method of behavior modification in which the animal is rewarded for successive approximations toward the desired behavior. This technique breaks down a complex task into smaller, achievable steps, reinforcing each step until the full behavior is performed. For example, to teach a dog to open a door, you would start by reinforcing any behavior that brings the dog closer to the desired action. First, reward the dog for simply looking at the door handle. Then reward the dog for touching the handle with its paw. Next, reinforce the dog for pulling the handle down, and finally for successfully opening the door. Over time, the dog learns the complete behavior by gradually increasing the difficulty and rewarding the animal for closer approximations. Shaping is particularly useful for teaching complex behaviors because it allows the animal to learn in small, manageable steps. It is a positive reinforcement-based approach, aligning with the ethical guidelines of the AVSAB, which emphasize reward-based training methods. This method avoids overwhelming the animal and encourages motivation through consistent rewards. Why is flooding considered a controversial behavior modification method, and what are its potential drawbacks? Answer: flooding involves exposing an animal to the full intensity of a fear-inducing stimulus until it becomes overwhelmed and eventually ceases to respond. While some practitioners believe flooding can result in rapid habituation, it is considered controversial due to its potential psychological harm. Flooding can cause severe stress and anxiety, leading to trauma rather than desensitization. In some cases, it may worsen the fear response, making the animal more fearful of the stimulus in the future. The intense emotional response can also impair the animal's ability to learn or generalize, potentially reinforcing the very fear the treatment aims to reduce. Ethically, flooding is considered a last resort as it can be harmful to the animal's emotional well-being. The AVSAB strongly discourages the use of flooding and recommends alternatives like systematic desensitization, which gradually exposes the animal to the stimulus in a controlled manner, minimizing distress while promoting learning. This method is more in line with ethical behavior modification practices that prioritize the animal's mental and emotional health. How can an animal behavior consultant effectively address a client's skepticism about a behavior modification plan? Answer: provide evidence-based outcomes. Consultants should provide scientific evidence or real-life case studies demonstrating the effectiveness of the behavior modification techniques. Explaining the rationale behind the approach, such as how positive reinforcement builds trust and motivation, can help alleviate skepticism. Establish trust through transparency. By being clear about the expected outcomes, potential setbacks, and timeframes, consultants can manage client expectations and reduce doubts. Sharing success stories and previous client experiences can also build confidence in the plan's success. Address emotional resistance. Clients may resist due to emotional concerns for their pet. By practicing active listening and showing empathy, the consultant can better understand and validate the client's fears, offering solutions and alternatives to address specific worries. The consultant should also reinforce that progress is gradual and requires patience. AVSAB guidelines emphasize transparency, empathy, and clear communication. By building rapport and actively engaging the client, behavior consultants can increase the likelihood of client adherence to the behavior plan and foster a positive outcome. Why is positive reinforcement preferred over punishment-based methods in animal training? Answer: positive reinforcement is favored because it encourages desired behaviors by rewarding the animal for completing the correct action. This approach builds trust between the animal and trainer, as the animal associates the trainer's presence with positive outcomes. Positive reinforcement also strengthens the bond and motivation to perform desired behaviors. Punishment-based methods, on the other hand, can cause fear, anxiety, and confusion. These methods can lead to aggressive behaviors or emotional harm, undermining the animal's trust in the trainer and damaging the relationship. Over time, punishment can cause the animal to become fearful of training sessions, leading to reduced learning and possible behavioral regression. The AVSAB guidelines advocate for positive reinforcement due to its long-term effectiveness and humane nature. Positive reinforcement aligns with ethical principles of animal welfare by prioritizing the mental and emotional well-being of the animal. This approach ensures that animals are trained in a way that is not only effective but also supports their overall health and safety. Why is the socialization period in puppies 3-4 weeks considered critical, and what are the long-term consequences of inadequate socialization? Answer: the socialization period in puppies is critical because it is the window when they are most receptive to learning about their environment, other animals, and people. Positive experiences during this time shape behavioral traits such as friendliness, adaptability, and social skills. The exposure to various stimuli, including different people, animals, and settings, helps prevent fear-based behaviors in the future. Inadequate socialization during this period can lead to long-term behavioral issues. Puppies deprived of these experiences may grow up to be fearful, anxious, or aggressive towards strangers or other animals. These traits are often harder to modify once the puppy has passed the critical window of socialization. Relevant guideline: AVSAB strongly recommends that puppies receive structured socialization from 3 to 14 weeks. Behavioral issues arising from lack of socialization can be mitigated with interventions such as desensitization and positive reinforcement. What are the advantages and limitations of using cortisol levels to measure stress in animals? Answer: cortisol is a widely used biomarker for assessing stress in animals due to its direct involvement in the stress response. One of the advantages of using cortisol is its correlation with both acute and chronic stress, making it a reliable indicator for behavioral changes. Additionally, cortisol levels can be measured in various ways, including blood, saliva, urine, or hair, which offers flexibility for non-invasive sampling, especially in fearful or stressed animals. However, there are limitations to relying solely on cortisol levels. Cortisol can be affected by factors other than stress, such as circadian rhythms, illness, or even diet. Baseline cortisol levels vary between species, individuals, and even over time, complicating the interpretation of stress. Thus, using cortisol as a sole indicator might not always provide a complete picture. Relevant guideline: AVS8B recommends combining cortisol measurement with behavioral observations and environmental assessments for more accurate stress diagnosis in animals. Dr. Rivera is consulted about a young Labrador retriever, Daisy, exhibiting severe anxiety when left alone. Daisy was adopted at 8 weeks old and has been reared in a stable home environment. Dr. Rivera learns Daisy's littermates have similar issues. How should Dr. Rivera approach this case, and what factors should she consider? Answer: Dr. Rivera should consider both genetic and environmental factors when diagnosing Daisy's anxiety. The fact that Daisy's littermates also exhibit anxiety suggests a genetic predisposition. Some breeds, such as Labradors, may be more genetically inclined toward anxiety disorders. Additionally, the early rearing environment should be assessed, particularly whether Daisy's early experiences with her mother and littermates were conducive to healthy emotional development. If Daisy experienced early stressors or lack of proper socialization, this may have contributed to her anxiety. Dr. Rivera should create a comprehensive treatment plan that incorporates behavior modification, environmental enrichment, and then possibly pharmacological intervention. For genetic factors, long-term management may require a combination of behavioral therapy and medications like selective serotonin reuptake inhibitors (SRIs). Relevant guideline: AVSAB recommends considering genetic predispositions and early life experiences when treating anxiety disorders in animals, and interventions should involve both environmental changes and behavioral therapy. How does neural plasticity facilitate learning in animals, and what role do environmental stimuli play? Answer: neuroplasticity refers to the brain's ability to reorganize its structure and function in response to experiences. In animals, learning occurs when repeated exposure to stimuli strengthens neural connections. For example, when training a dog to perform a behavior, repeated practice and reinforcement strengthen the synaptic connections associated with the desired action. Environmental stimuli such as social interaction, novel experiences, or training cues play a key role in shaping these neural pathways. Stimuli that are rewarding or positive tend to reinforce learning, while negative stimuli may result in avoidance behaviors. Without adequate stimuli, particularly during critical developmental periods, neuroplasticity may be limited, leading to underdeveloped behaviors and cognitive abilities. Relevant guideline: AVSAB recommends employing positive reinforcement strategies to promote optimal learning and neural development in animals, particularly during early socialization periods. Discuss the role of oxytocin in promoting social bonding and its implications for animal behavior therapy. Answer: oxytocin is a hormone and neurotransmitter that plays a central role in social bonding and attachment. It is released during positive interactions such as grooming, nursing, and physical affection. Oxytocin facilitates trust and reduces stress, which is why it is often referred to as the bonding hormone. In animals, oxytocin release promotes positive social interactions and reduces fear or aggression. In behavior therapy, oxytocin can be leveraged to enhance positive interactions between animals and their handlers. For example, in fearful or aggressive animals, controlled positive interactions can increase oxytocin levels, which can reduce stress and promote trust. This is particularly helpful in cases of anxiety or socialization issues. Relevant guideline: AVSAB supports the use of positive reinforcement and controlled, nurturing interactions to promote the release of oxytocin and improve behavior, especially in fearful or socially isolated animals. How does maternal behavior impact the long-term behavioral development of offspring? Answer: maternal behavior plays a significant role in shaping the long-term behavioral development of offspring. Positive maternal behaviors such as grooming, nurturing, and protection help regulate the stress response and promote social behaviors. For example, pups raised by attentive mothers are more likely to exhibit calm and adaptive responses to new experiences and environments. Conversely, neglect or inadequate maternal care can lead to maladaptive behaviors such as increased fear, aggression, or social isolation. These animals may have higher stress levels and reduced coping abilities. Relevant guideline: AVSAB recommends early intervention in cases of maternal neglect, promoting positive maternal behavior through behavioral therapy and support. Early experiences have lasting impacts on the animal's future behavior. What behavioral signs distinguish acute stress from chronic stress in cats, and how should they be addressed? Answer: acute stress in cats manifests as immediate behavioral changes such as dilated pupils, hissing, growling, and defensive posturing. These responses are typically linked to short-term stressors like loud noises or unfamiliar visitors. Chronic stress, however, leads to long-term changes in behavior such as excessive grooming, hiding, loss of appetite, or aggression. Cats with chronic stress may also develop compulsive behaviors like overgrooming or inappropriate elimination. Chronic stress should be addressed with environmental modifications, such as providing more hiding spots, enriching the environment with toys and scratching posts, and using pheromone diffusers. In severe cases, medication or behavioral therapy may be required. Relevant guideline: AVSAB encourages stress management techniques and environmental enrichment as primary interventions for chronic stress in cats, along with veterinary consultation for severe cases. How does chronic pain influence an animal's behavior, and what steps can be taken to address it? Answer: chronic pain often results in altered behavior in animals. Pain may cause a reduction in activity, irritability, aggression, or withdrawal from social interactions. For example, a dog suffering from arthritis might avoid walking, exhibit irritability when touched, or become more aggressive toward other pets or people. The underlying mechanisms involve changes in the central nervous system that alter the animal's perception of pain, as well as changes in behavior to protect the painful area. To address chronic pain, pain management strategies such as anti-inflammatory medications, physical therapy, and lifestyle changes should be implemented. Providing a comfortable resting place and avoiding activities that exacerbate pain can also help. Relevant guideline: AVSAB recommends a multidisciplinary approach to managing chronic pain, combining medical treatment, environmental modifications, and behavioral interventions.